Welcome to IMCAS TV 10 Minutes with S&V Technologies. S&V has a full range of dermal fillers, long-lasting biphasic fillers for strong volume augmentation, as well as monophasic dermal fillers for standard aesthetic treatments, both types with low to high cross-linkage. I am here with Christine Kreiner from Germany, the founder and CEO of S&V. Welcome.
Thank you.
And I wanted to start our discussion by finding out what's new since last year, since our last IMCAS interview.
Well, since last year, we developed, first of all, a new dermal filler, low concentration, low cross-linked, but with a long-lasting effect. This is new. Then we completed our cosmetic line based on a transdermal complex of hyaluronic acid. And finally, we finished our growth product for lashes and eyebrows.
Eyelashes,
which is also new. We also applied for a patent for that.
And what is the special feature for the low concentrated dermal filler?
Usually, low concentrated dermal fillers last not long, but in this case, it is not a soft gel as the other filler on the market are. It is a monophasic filler, but not soft. It has particles. And due to the special galenic, it lasts very long, much longer than all the other products
and
on the market.
And distributes evenly.
And the application is especially for these very sensitive areas like tear trough, orbital frame injection, which is a problem for patients. So we are happy to have a product which lasts long.
Yeah.
This is absolutely new.
That's wonderful. And I think we do have a slide. We can go to the slide and maybe you can tell us about it.
Yeah. You see first, on the right side, the immediate reaction after injection. So you see already the great improvement.
Huge improvement.
But we find out that the improvement is increasing over time. So after 4 weeks, you see already, it's always, it's another patient, yeah?
Without having another injection.
Yeah.
This is the first.
Without, no other injection. And after 4 months, it's still quite a lot of material in. So we finished right now a clinical trial with 100 patients. And
Can you give us the outcome?
Yeah, we have still 80% of the material left after 12 months. It is coming up after 7 months is the best result. And it's still going on, 80% material after 12 months in the tear trough.
So how many times does it need to be repeated?
Only after 12 months, we ask the patients if he wants to get an improvement or not. And quite a lot of patients say, no, we are satisfied. 86% of the patients were satisfied after 1 year. They didn't want to have an additional treatment.
That's wonderful. That's a very good success rate.
Yeah. Thank you.
And you mentioned a new cosmetic line. There's so many cosmetics on the market. So how do you differentiate your products from the other products, especially from the big companies?
Well, we also have developed something very new. We have, very new. In cosmetic, it's new, not in the pharmacy. No? We developed a new transdermal hyaluronic acid complex. We have no dimeticon, which is silicone oil. We have no paraffin oils in it. So there is no oily layer which hindrance the hyaluronic acid complex penetrating and working in the deepness of the skin. The idea to bind an active ingredient, or like hyaluronic acid, on a hydrolyzed lecithin is known in pharmacy, but not in the cosmetic range. So we use that principle, and we have a real transdermal hyaluronic acid efficiency.
And another important feature of this new cosmetic line is that it's the optimal treatment in cases of allergy.
It is only based on natural components.
Right.
And that's really surprising that all these allergy people saying, oh, in wintertime we cannot use it because we have a coldness allergy, they are healed.
So really for all skin types.
Yeah, it's great.
All skin types. We do have another slide.
Yeah.
If we could go to the next slide and you can tell us about this.
You see here, the blue line is the active ingredient without lecithin, and the yellow, the green
Green line.
line is with lecithin. You see that it is first has to penetrate a little bit, and then it's increasing tremendously. And this is exactly what happened in the skin. If you use a hyaluronic acid lecithin complex, it is hydrolyzed lecithin. It's a mixture of different lecithin formations. It goes into the skin. The only problem is if a patient, if you are used to a standard cosmetic with oil, no? Silicone oil or something like this, you do not feel with our cosmetic, but it penetrates very quickly. You have to get used to, and after 2 weeks, you look beautiful and young.
Quickly and efficiently
Yeah.
and safely.
And safely, of course. Only natural components.
Exactly. And there are several products on the market which stimulate the growth of eyelashes and eyebrows. What's the difference in your product?
It's again something which, you know, we are several PhD in chemistry, so we have to develop new things.
Everything's based on science.
So what we did is we make a hyaluronic acid gel where we dissolve a water-soluble complex of the active ingredient in cyclodextrin. There are several on the market, you are right. It's bimatoprost, lanatoprost, and tafloprost. All three are only soluble in alcohol. But you can imagine if you use it as an eyeliner, it's not very, very good for the eye.
No.
So we developed a water-soluble complex between the active ingredient and cyclodextrin. And this water-soluble complex is dissolved in hyaluronic acid gel. And the nice thing is that hyaluronic acid itself also enhances the growth of the lashes and the eyebrow. So we have a very efficient product.
Working in combination.
Yeah, of course, working in combination. And after 6 weeks, you see already very nice results.
We have another slide. Can we go to the next slide?
So you see here, this is one of our employees. And you see left side, if you compare the picture on the top and the picture down, you see the enhancement already after 3 weeks.
3 weeks.
And then it's growing, continuously growing. If you have reached the length and the thickness of the lashes you want, then you have to repeat it twice a week. Then after
for maintenance.
Yeah, or you just leave it, and after around 2 months, your normal lashes are back again.
Wonderful. And you are the manufacturer of the dermal fillers in Germany. What is your experience with the approval procedures outside of the European market?
This is a very interesting question. Within the European market, we still have the Medical Device Directive, but this will also be changed and will be adapted more what is happening outside of the European market. For example, Taiwan, Brazil, there are these products considered like drugs. So we have to submit much more clinical trials, much more long shelf life testing, things like that. This will also come in the European market. We will have a period of around 2 to 3 years, and then all dermal fillers which are on the market have to be tested like this. This is good for the patient.
It's good for the patient. It's good for the doctors.
It is perfect for the patient and also for the doctor, but it is a time and costly procedure. So the small companies will have some problems. And it might be that the market will be even more dominated by the big companies, but the small companies are more innovative.
More innovative, more creative.
Yeah, so we lose a little bit of these advantages. No?
Thank you so much, Mrs. Kreiner, for joining us, and best of luck to S&V.
Thank you very much. It was a pleasure for me.
Thank you.
Bye-bye.